I chose neurology because it's, I believe, the most interesting and dynamic area of medicine. There's a vast number of advances being made in this field, and every day there seems like there's something new coming out. Whenever there's something on the news about a new area of medicine or a new breakthrough, it's half the time it seems it's in the field of neurology. I specialize in multiple sclerosis. Perhaps half of my patients are patients with that condition. I also see patients with a number of other neurological conditions, to include migraine headaches, Parkinson's disease, dementia, the various forms of dementia. A lot of times people think that dementia is the same thing as Alzheimer's disease, but that's not the case. My average day is spent primarily seeing patients in follow-up. I have a vast number of patients that I see here in the neurology clinic, and a long-standing relationship with most of them. So they come in and I see them and do a physical exam, ask them how they've been doing, assess their response to medications, and decide if we need to make any changes or do any further diagnostic tests. I also see a few new patients every day, and that's very exciting for me because it's always nice to see new people and to be able to see what needs to be done to make a diagnosis and be able to help them. See people for epilepsy. I have quite a few patients with epilepsy in my practice. A portion of my practice is devoted to treating patients in clinical research trials. I like to develop a personal relationship with my patients by really getting to know them and know the interactions with their family members, know the names of their pets, how many stairs they have in their homes. Just all that type of stuff is invaluable in proper management of the patient. I try to help the patient to understand his or her condition, and there are neurological diseases for which there are no completely effective treatments, and I try to help them understand that. Something that I push with my patients is you have to look at everything from the risk versus benefit model. So I try to go with something with the highest benefit and lowest risk at first, and then we work our way through until we find something that is effective to get the problem under control. I've always enjoyed clinical research because it allows my patients to have an opportunity to participate on the forefront of science, to allow them opportunity to use new medications that might be not for a condition that might not be currently treatable, and they see how the scientific method works. They interact with their physician. They see how science works, and they understand more about medicine by participating in clinical research. I get the most satisfaction from allowing patients to have a normal life. I'm Dr. Lloyd, and I'm a neurologist here at Riverside.